Welcome to KizaziYouth. My name is Anthony Maragu, your host. And today, as we continue the conversation of assessing what's the Kenya's standing as far as mental well-being is concerned, it is good to note that Thursday of this week is World Mental Health Day, Mental Health Awareness Day. The well-being of a human being is measured in these three aspects. One is spiritual well-being. Two is a physical well-being. As far as the first aspect is concerned, the spiritual well-being of a human being, we go to church and pray. The physical well-being, we go to the gym and work out. We also go for maybe our annual wellness checkups in hospitals. Unfortunately, there is one aspect that we seem not to have taken seriously in the issue of the mental well-being of a human being. So today, we are joined by Dr. Arthur Muriuki, a psychotherapist, founder of the Brain Initiative, and a practitioner at various hospitals within Nairobi. Welcome, Dr. Karibu sana to the show. So, 10th of October, which is Thursday, a day from today, is World Mental Health Awareness Day.
Yes.
Today's conversation is just to try and assess, from an expert point of view, the standing of mental well-being in Kenya. What is your take?
I think the increasing awareness in our country on mental health issues and the stigma around has helped in reducing the stigma around mental health. We are moving away from the attitude towards mental health being associated with witchcraft and being insane and a lot of ignorance that we thrived within now is being wiped out with the increasing awareness and a lot of good work is being done by journalists and the general media to explain and to create this awareness. We have more and more people confidently talking about what they're suffering from and the challenges that they're facing, and that is helping, though still with some stigma attached to it, that is helping create that awareness and even encourage more people who are suffering silently to come up and talk about this.
So, as far as the health centers or rather the health system in our country, you say that it has improved. Let's take an example where somebody has ingested poison, for example, of course on a mission to commit suicide, and today they visit a government hospital or a sub-county hospital somewhere, and the approach by the doctors there, maybe due to the lack of there being the sensitization of the importance of mental well-being, the doctors will rush and they'll take care of the poisoning that that gentleman or whoever it is has ingested, but there seem to be a disconnect between now making sure that this client or this patient does not present back with the same issue of them trying to ingest poison or rather to commit suicide. What is the Ministry of Health, or what are we doing to make sure that should we receive such a patient, we proceed now to the next level where we identify the cause?
That's a very good question. Initially, even the attitude towards such behavior, where there is an attempted suicide, within the law, it was still is considered as a criminal offense, and it's punished under the penal code. But with the increasing awareness of what mental health is and what mental health is not, and what mental illness is and what mental illness is not, we now have a mental health policy that is helping to change attitudes, even within government structures, even within the police, within the schools, within even hospitals, within other structures of society, even within the legal systems, where this person is the first line of treatment, like you mentioned, is once they are presented to the hospital, the first line of treatment is to evacuate any poison that they have ingested. And the second part now is, and you've pointed a good example, that there's a gap. After they've taken out the medication, they've not resolved the issue that brought them to the poison in the beginning. So what we are trying to do, I cannot, I'm not able to speak with the Ministry of Health, but maybe at the end I can give an advisory opinion, is what we are trying to do now at the BRAIN Initiative is to create referral structures, very well developed referral structures amongst very passionate practitioners. So, for example, you have a team of psychiatrists who are very quick to respond and who are very aware of how time is a factor in saving lives. We also work closely with pediatricians. If, for example, the issue is of a child who's attempted suicide, we're working also very closely with geriatric practitioners so that if it's someone who maybe is in their old age and despaired and they're thinking about death, how do we make this person reach these services in the shortest period of time? I have seen other initiatives privately that have been taken by hospitals, and this is good. This is good. So to answer your question, when you receive, or when maybe your local government hospital receives a patient who's attempted suicide, and they've taken care of the medical aspect of it, and they don't know what to do next, it's a tough one, because if the administration of that hospital has not taken the initiative to create a pool of practitioners, so that if they're not able to house them in-house, if the government is not able to employ them, who then can they make a quick referral to, whether it's a private practitioner or maybe if it's another private hospital entity, large entity. So the advisory opinion that I would give here is that initially we've seen these counseling, the skills being extended to the nursing institutions, so that as the nurses graduate out of nursing school, they have some basic skills on how to identify these symptoms and how to maybe reduce any emergency situation and calm the patient long enough for the practitioner to arrive.
Today, a patient presents somewhere in Bagadi Hospital, for example, with poison or intent to commit suicide. Once the doctors and the medical team have attended to removing whatever poison the person has ingested, maybe received that the person is well now because they are off the risk of the poison that they have ingested, a few minutes ago or now. What is the next step of action? Is it to engage, a mental health expert, or as you said, suicide is illegal in Kenya? Is to engage the police. What is the practice now that you have experience being in the medical field?
I'm not aware of any case that has entered a healthcare facility with regard to suicide, and they have pushed these to the police. And one, this would be unethical to do that, because now the awareness has also been extended to medical practitioners to know that this is not a crime. This is a situation that has overwhelmed this patient, and when they are coming in the beginning, even leaving the house to come say to you as a medical practitioner, I have ingested poison, that it takes a lot of courage. Okay, so when you then send or push this person to the police, so you tell them, just give me a few minutes, I'm going to get medication, and then you bring a police officer, then that is counterproductive. It goes even against the ethos of medical practice, because then you're coming to punish a patient who is suffering. How does that help? That is not treatment. There's no place in the ethics of medical practice where engaging the police in a healthcare system is a treatment approach. Okay, so everything contained, treatment is normally contained in a hospital, and only when the healthcare facility is not able to provide specific medical treatment do they then refer to another facility that is well equipped. The police are not trained to take care of mental health issues, so the police is not part of the healthcare treatment. So making a referral to a police station, then that would mean that this specific doctor then needs also to be considered as a patient. Okay.
Our youth. I was shocked recently when I started getting interested in mental health. That indeed the second leading cause of death among people of ages 15 to 29 in the world is suicide.
Yes, there's an increasing number of attempted suicide, and also an increasing number of successful attempts. Okay, so there are those who attempt and they fail.
Yeah.
And then there are those who attempt and are successful.
Yes.
There are those who fail on the first attempt. If the issue is not resolved,
Yeah.
then the second attempt is successful.
Okay.
And there are those who are successful on the third attempt.
Yeah.
I am aware of certain situations where I have had patients say they've attempted 6 times.
6 times.
Okay, and every time someone intervened to stop them.
Yeah. Yeah.
So what could be? So what are we learning as the causes now? So it varies from one person to the other. And now, and one of them we are now learning that with the increasing awareness, with more youth going to school and getting to interact with the global citizen, becoming global citizens in the era of YouTube and technology. So they're beginning to learn more about how what could be causing their own problems. They're beginning to learn about how their parenting when they were younger could have affected them. They're beginning to learn that what they went through as children was not normal, especially if it was very with a lot of physical abuse or emotional abuse or the sexual abuse. That they're beginning to know that this was not normal. That the people who they were entrusted to that turned out to be the aggressors, and even the reality of that then is in the first place beginning to affect them. How could you do this to me? So as the brain comes to terms with the adverse child, we refer to them as adverse child experiences, with the traumas of childhood, the beginning, the brain is finding it increasingly difficult to cope with these experiences. And now the responsibilities of adulthood are coming up on someone who has not resolved the issues of the past, the earlier years of living. So coping with these overwhelming experiences, one is predisposing them to a lot of stress. Their capacity to cope and the resilience is becoming highly compromised. So this person goes out there to look for a job, and they encounter the same people who are continuing to abuse them and harass them and torment them, or disregard them as youth and ignorant and all that. Then it's becoming a bit harder for them to cope. Okay, so they are suffering on the onset, and then when they go to interact in the adult world, then there's more pain. So that's one. The capacity to be resilient is compromised. The second bit that we are learning now, the substance use. There's a prevalence of substance use. So the cannabis, or commonly referred to as bangi, it is very easily accessible. And it's surprising how easily accessible these drugs are. When we were growing up, it was very rare, and it was horrifying to think that someone has access to cannabis. But these days, if you don't have a dealer, then you're the one who's out of fashion. Okay, everyone has a dealer. So there's cannabis use. There's also an alarming increase in the hard drugs, the cocaine, heroin, ecstasy. And these young people are turning to these drugs, not because they're really excited about taking them. It's because they are looking for a way to cope with the stresses, and they are willing to part with with a lot of money to get that memento feeling of bliss. I will shoot up on any hard drug just to feel normal for a few minutes, just to feel happy. And some are able to achieve that. But then what they quickly forget is that this substance is not a naturally occurring substance in the body. So once the brain gets access to it, then it gets quickly hooked on it, and it changes the brain structure. So once you withdraw this substance from this child or this young adult, then the brain constantly will demand for it. And that's how a lot of addiction is building up, addiction and dependence. So you have someone now who's struggling with their childhood. They've gotten on medication. They're self-medicating. They're using a lot of alcohol and other hard drugs. And then this person now is not getting any access to employment opportunities. So it's becoming, among us, the youth, especially on the lower income spectrum, that it's becoming increasingly difficult once in the first instance to cope with what's going on internally, and even in the external environment for them to deal with the stresses around them.
When do I, as a young man, know that I need to seek help as far as my mental well-being is concerned.
You need to seek help if you notice that your mood is changing, you're becoming more irritable, you're getting angry easily. You need to seek help if you notice your appetite is changing. You're either beginning to eat too much or not feeling hungry at all, or not needing to eat. You need to seek help if you notice you are having trouble falling asleep, or if when you get to bed you're sleeping throughout and you don't want to wake up. So increase in appetite or a reduction in appetite, increase in sleep or no sleep at all. Okay, so variation. You also need to seek help when you notice that you're constantly fatigued, you're tired, and you've not done work that you've not expended a lot of energy. You're just generally tired throughout the day. You need also to seek help when you notice that it's becoming increasingly difficult for you to feel happy. You're most often feeling sad, and you're most often wanting to withdraw from people who expect you to entertain them, maybe to hang out with your friends. You also need to seek help when you notice that you're beginning to get physical pain, that when you go to hospital, the doctor says you're okay. In most cases, the lower back pain, the joint pains, the headaches that are not explained, stomach upset, you're getting ulcers, you're getting bloated stomach, and you've not changed your diet. So once you begin to see these changes, all is not well. And what would encourage young people especially is that mental health symptoms, mental illness does not go away when you ignore it. So once you keep quiet and ignore it, it doesn't mean that it will go away. So seek help, and there are good services available.
What would you tell a youth today out there that is feeling probably depressed?
To the young man and young lady listening to this, if you notice or if you identify with any of these symptoms that I have described, these symptoms will not go away if you ignore them. Okay? So they only get worse. So that's the bad news. The good news, however, is once you identify these symptoms early, there are very good treatments available for you. We have very good medication. If an assessment confirms that you need medication for the treatment of the condition, and if the assessment does not require, it gives us results that don't require medication, then there are very good outpatient services that you can receive that we get to, for example, find out what is the genesis of these issues. Is it a genetic issue, or is it an environmental issue, or is it a combination of both? So there is hope. You do not need to end up on a noose or in ICU after you've taken medication before you speak out. So what I'd like to encourage you to do is speak out, talk to someone, send a message to your friend. If you do not want to talk about it, send a text message and just say we need help. You can send it to a friend who maybe can accompany you to a healthcare provider. So there is hope. If you ignore it, it will not go away. If you can talk, then the burden is lessened. And there is hope. You will grow old to see your grandchildren.
Dr. Arthur Muriuki, we are glad to have you in our show. Maybe now tell us, the people who are going to be watching us on our show, how can they reach you?
Okay, so we run an outpatient private practice on the Pony Road called the Brain Initiative. There are links if you search the Brain Initiative online, not the American one, the Kenyan one. The Brain Initiative information is online. You can get links on how to book a session, and there's a lot of freedom that is given to the patient to schedule. I also run an outpatient clinic to the Karen Hospital, Karen, on Fridays, and also I'm also a consultant with Chiromole Medical Center, Bustani, and that we see patients, both inpatients and outpatients. So those are the few places you can find.
Good. Thank you so much, Dr. Anna, for making time to be with us, and we hope to really continue this conversation some other time. Thank you so much. Thank you so much, our viewers, for joining us on the show. We are going to continue with more of these conversations until we integrate mental well-being to our medical centers, until such a time when mental well-being will be accessed at your local dispensary and eliminate the stigma that is associated with mental health. Join us next time on the show.